What we investigated was about breast cancer in the elderly patients. And those are patients that are 65 years and above. They are classified as elderly according to the World Health Organization. And the interest was in this particular set of patients, knowing that in Nigeria and in other parts of Africa, to be specific, breast cancer is commoner in the middle age and the younger patients. And most of the previous studies are focused more on those subset of people, which is understandable because they are the numbers. But when we talk about elderly, in the high income countries, pattern has shifted on how to manage them. People are talking about too much, too little, but we don't even know so much about our own demographics. So that's why we studied this set of patients. So from the study, surprisingly, we used the database that has breast cancer patients only on the database. It's a single institution database, and we found that the percentage of patients that were 65 years and above from that database was about 14.3%, which is quite low compared to what is obtainable in high income countries. And another thing we found is that they were what is classified as the young older patients. That says good number of them are less than 75 years old. I think we have just one patient that was above 80, and that is really surprising because in the high income country, they have so many patients from 70 years and above that is in this school. And maybe that's probably affected some of the things we got because people talk about comorbidity as being a major factor when you're talking about elderly. But in this cohort, we didn't see so much of comorbidity. We only saw 29.8% of these patients actually had comorbidities. And hypertension is the commonest one, followed by diabetic mellitus. So, and the history of having previous malignancy and all that was really low in this set of people. So, it's probably skewed what we got as per. That did not affect how they are treated. But one thing that is important for us to know is that we did a back review to check on people that had breast cancer that were lower than 65 years old. And we found that these patients with the older patients compared favorably in the time they presented. The patients in this cohort presented late, which is the same thing with people that are younger patients. And we found that majority of them have invasive ductal carcinoma. Immunohistochemistry, which is meant to be like a deciding factor on how to treat better, we didn't see significant difference, but that might be because very low number of patients actually had immunohistochemistry in the two groups. So, but those that had hair, we found that half of them are actually ER positive, which could actually help in the treatment that they are given. So overall, we found that there is no significant difference in this cohort of patients compared to the younger people in terms of when they presented, the size of the tumor they came with, and the kind of treatment they received. So one of the things that I think will be implication of these findings is that number one, uh, with increasing quality of life, with increasing medical access in the low middle income country, there's going to be an increase too in in people living long, and if they do live long, the chances of having breast cancer will be higher. So I feel that it's time for us to start preparing for those kind of patients and how to manage them. That's one. Two is that this should really concern all of us that when we are talking about fight against breast cancer, we need to know that if we patients are not coming in early, it will impact the management. And this does not only happen to the younger people, even the older patients too are coming late. And some might argue that, of course, older people might come late because they are neglected, because they don't have health insurance, they don't have all that. But that means that in this fight with breast cancer, we cannot afford to focus on a group of patients. We need to have an all-encompassing focus on everybody, both the younger population and the elderly population. And another amazing thing is that the older population are likely going to have a easier path to the management if they were picked early. so they can have minimal treatment based on what we can take. What do I mean? As in, there's a paper called Choosing Wisely Guideline. The guideline actually tell you how will you treat people that are 80 years and above. Like I said, we don't have so many in this cohort, but going forward, who knows how many of people we have? So we need to start preparing our mind, and I think the government should like rise up to the cost, like improving policies that will allow screening for patients in Nigeria and in Africa as a whole. And I think that's definitely a breast cancer treatment going forward.